I'm Liz Allen, and I'm here to talk to you about if we can replace conventional sanitary indicator testing with the new 3M E. coli coliform Petri film testing method to reduce costs in testing while maintaining quality of results. Coliform bacteria and E. coli are indicators of a sanitary environment. Since 1914, the U.S. Public Health Service has used the enumeration of these bacteria to measure sanitation. The current FDA-approved solid medium method uses violet red blood agar with or without the differential chemical MUB, which allows you to differentiate between normal coliform colonies and E. coli colonies using a UV light. This method requires significant time, training, validation, and labor. The E. coli coliform Petri film method is a sample-ready version of the VRBA media with a different indicator chemical, BCIG, which differentiates between coliform and E. coli colonies by turning E. coli colonies blue. A cost analysis was performed on the VRBA method and the VRBA MUB method, taking into account labor and equipment and reagents of one-time use in this method. Here you can see a list of equipment or reagents used that are unique to this testing method or used once and need to be rewrote again, in the quantity sold and the price of these things. The price per plate of each piece of equipment was calculated and added together for a result of $119 per plate for the VRBA method and $184 per plate for the VRBA MUB method. Taking into account the work time for each method of 2.5 hours for the VRBA method and 3 hours for the VRBA MUB method, and the base lab tech pay of $16.72 per hour, the total for each method was calculated by adding the reagent and equipment costs as well. The VRBA method was $6.41 per plate, and the VRBA MUB method was $8.11 per plate. The same method was used for the cost analysis of the E. coli Petri film method. Here you can see the list of equipment and reagents necessary, the quantity they're sold in, and the price per Petri film. Totaled up, the price for equipment and reagents is $2.98 per Petri film. Based on the 1 hour work time for this method and the base lab tech pay, a total for this method is $5.07 per Petri film. A study by Linton, Easel, and Mariana in 1997 on ground beef samples compared the VRBA MUB method with the Petri film method. A p-value of less than or equal to 0.5 was considered statistically significant. Here are their results with the p-values circled. The results indicated that the Petri film method was an acceptable replacement for coliform enumeration, and that it was actually better than the conventional method in E. coli enumeration. The second study was completed in 2001 by Park, Seo, An, Yu, and Kim. Tested samples of chicken, pork, and beef over a 6-month period, and a correlation coefficient of 1 was optimal in this test. The correlation coefficients all were below 0.83, and they are circled here on the table they produced, indicating that the Petri film method is an acceptable replacement for conventional methods in meat samples. Study 3 was completed by Souza, Costa, Nero, Cotto, and Ferreira in 2015. They tested 30 samples of sheep's milk, and a p-value of less than 0.5 indicated high variability in results. The p-values they obtained here are both significantly higher than the p-value of significance of 0.05, indicating that the Petri film could be used as a replacement for conventional plating methods in the testing of sheep's milk. In conclusion, replacing conventional plating methods with Petri film plating methods would be financially beneficial, but would still maintain accuracy of results. If you did use the Petri film in place of the conventional methods, you would save $3.04 per plate, which is a 37% savings. I would recommend that quality assurance food laboratories transition to using the new Petri film method and replacing their conventional method. Step one would be to order samples of Petrifilm and test the food they're producing with the Petrifilm and compare it to their current results to make sure that it performs in the same way. Next, they should inform lab staff of the changes and give them an implementation timeline. Next, they should train staff before the new method is implemented. Then they should contact the lab's bulk sales associate to get the equipment and reagents necessary to complete this method. On implementation day, they should enlist the help of an expert to be there to answer questions of lab technicians and provide insight and support. During the first week of using the new method, I would say it's a good idea to consult with lab staff on what they think about the new method, listen to their comments and questions, and have a positive attitude. And then I would say it is good to keep a running list of the results using the new method and compare it to past results to ensure that you are maintaining the quality of results you want to be getting with this new method. Any questions?